Marvin Plackett, and today is Monday, August 17th. Greetings to all residents, to all staff, and to all guests. It's a sobering report today. I, of course, was last with you on Thursday, and we have had a spike in COVID cases. We currently have 18 active COVID cases, 11 residents, and 7 staff. One resident lives at King's Crossing, and 10 residents live on Sister Annette House at Episcopal Church Home. And I'm going to read you a letter from Melissa Schneider, the administrator, and of course some of you have seen this letter, but most of you haven't. To our ECH families, today we received, this was written on Saturday, today we received results detecting 8 Episcopal Church Home residents positive for COVID-19. All 8 of these residents reside in our Sister Annette House. However, since then, so that was on Saturday, as of this morning, we have 2 more. So 10 of the 12 ECH residents that live in Sister Annette House have COVID-19. I know this is a very discouraging news for our residents, families, and staff. Based on these new results, please review the following actions as we are taking. The Sister Annette household has been fully isolated as a COVID unit with specifically assigned staff who will only work with these residents. We are testing all ECH staff and residents this week on Tuesday and Wednesday, and actually it's starting today. So today, Monday, and then tomorrow and Wednesday, we're going to be testing all residents and all staff throughout all the houses, so in other words, all of Episcopal Church Home, to do our best to get a full understanding of who has COVID and who doesn't. And hopefully it's just isolated to the Sister Annette House, but we do not know that. Effective immediately, we will be canceling all outdoor, essential, and compassionate care visits. We will revisit this restriction after we get our whole house test results back. We will consider hospice visits on a case-by-case basis, but I strongly encourage reconsidering your visits until you have the test results back later this week, until we have the test results back later this week. We have removed all staff who directly cared for these positive residents from the schedule pending further testing. We plan to do a second round of testing once our first round is complete. Our infection control team is working through the weekend to ensure all the necessary safety measures are in place for residents and staff. And we continue to follow direction from the Minnesota Department of Health and all the practices that we employ. We continue to be vigilant, et cetera, et cetera, et cetera. So, you know, this virus is really tenacious, and clearly it is stealth in that at the time that all of Episcopal Church Home was tested last week, no one had symptoms. Now all 10 of those residents that are on Sister Annette House, they now have symptoms. They tested positive and they all have symptoms. But for a period of several days, they clearly had it with no symptoms. And so this is really a serious matter, not just this recent spike, but just in general it is. And of course, we were warned that this might happen in that maybe it was a week ago, the Minnesota Department of Health and the governor warned us that they're starting to see a spike once again in long-term care. Well, we are part of that. And of course, we know that as society frees itself up more, and as children now soon go back to school and people start to get tired of wearing their masks at all times and staying in only small groups and social distancing rather than large groups and not social distancing, that we as an organization, we become more vulnerable to the possibility of it coming in. So how did it get in? We don't know how it got into the Sister Annette House. Maybe the source tracing that we will be doing now will disclose that, will reveal that, but as of this time, we do not know. Could it have been through one of our visitors? Possibly. Through staff? Possibly. We just don't know. And so this is, this really shows, it really proves how important it is for all of us to be vigilant at all times. All residents, all staff, all guests, and of course, I should clarify too that right now then, that Episcopal Church Home and the Gardens, because the Gardens last Friday, some of you would have seen that in my written Friday update that I put out last Friday. But both Episcopal Church Home and the Gardens have now gone back into lockdown, the way we were a few months ago, where we're not allowing any visitors in, and only unless they're specially approved as a result of a hospice visit. And we hate having to go back to that state, but that's what we have to do in light of these spikes at Episcopal Church Home. And of course at the Gardens, we've had a few staff test positive. And now let me move on to the Gardens. So last week, major testing was completed at the Gardens. All those tests have now come back, and all the residents have tested negative, so that's really good. And we've had no new staff, possibly one new staff person at the Gardens. I'm not sure about that. Both at Episcopal Church Home and at the Gardens, between today, tomorrow, and Wednesday, there's going to be major retesting occurring, so that we, again, as much as possible, contain it, that we know, that we discover the facts as to who has it and who doesn't, and then we do our tracing, and that we isolate, et cetera, and employ, of course, all our infection control measures that we've had in place for months, just doubling our efforts. But this really does show how vital it is that all of us be vigilant at all times with our social distancing, with wearing our masks properly, and those proper wearing masks, that means covering both the mouth and the nose. And that if we have any symptoms, that we self-isolate promptly and get ourselves tested, and then that we wash our hands frequently. So those measures are really important. Let's see if there's anything more to cover. I think that is it for now. So I look forward, remember I'm now doing updates on Mondays and Thursdays. So I look forward to giving you an update on Thursday, and certainly by then we will have had the results returned, at least by a substantial number of the tests that are being conducted here over the next few days. So know that Episcopal Church Home staff are working very diligently. All of us at Episcopal Homes are working diligently to contain this and to employ all the practices that are required by the Minnesota Department of Health. We feel deeply for everyone, and we're all in this together. Can't just be the staff, though. Of course, it has to be everybody that is at Episcopal Homes. That's all residents, all staff, any guests, any caregivers that come in from the outside, etc. All right, wish you all well, and I look forward to seeing you on Thursday at 1:30. Bye-bye.